Peripheral blood oxygen saturation, SpO2, is an essential indicator of respiratory functionality and received increasing attention during the COVID-19 pandemic. Clinical findings show that COVID-19 patients can have significantly low SpO2 before any obvious symptoms. Measuring an individual's SpO2 without having to come into contact with the person can lower the risk of cross-contamination and blood circulation problems. The prevalence of smartphones has motivated researchers to investigate methods for monitoring SpO2 using smartphone cameras. Most prior schemes involving smartphones are contact-based. They require using a fingertip to cover the phone's camera and the nearby light source to capture re-emitted light from the illuminated tissue. In this paper, we propose the first convolutional neural network based non-contact SpO2 estimation scheme using smartphone cameras. Peripheral blood oxygen saturation, SpO2, received attention during the COVID-19 pandemic. Patients with COVID-19 have greatly low SpO2. So to reduce the risk of infection, measurements can be taken without human contact. Researchers came up with the idea to explore methods to monitor SpO2 using smartphone cameras. SpO2 indicates the level of oxygen saturation in the blood. Assessing and monitoring SpO2 is necessary to assess lung function. Traditional methods of measuring SpO2 have the risk of cross-contamination between people using the same measuring device. Scientists have begun to explore the possibility of measuring SpO2 using video. This is a difficult task because the psychological signal is psychological signal in non-contact measurement is much weaker than in contact one. So this paper presents a neural network model that extracts 3 color channels from the video to measure SpO2. This work is the first of its kind. In this paper, we look at the hand area as a proof of concept. Using the hand to measure SpO2 is more private than using the face for objective reasons. SpO2 is a ratio of oxygenated hemoglobin to total hemoglobin. The normal range of SpO2 is between 95 to 100%. A practical and non-invasive way to constantly measure SpO2 is pulse oximetry. Pulse oximeters use ratio factors and pulse oximeters are widely used today in hospitals, clinics and, for example, at home. A pulse oximeter measures the change in wavelength of light passing through a finger. SpO2 is measured in this way.